Everybody knows about the Bermuda Triangle. Whenever anything goes in there, it just never comes out. But what most people don't know is that there is a care desert in healthcare where you can fall in and never come out. EasyCare2go set out to help resolve some of this problem. So the triangle points that's in this care desert sits between emergency rooms, hospitals, and insurance. This is the triangle. And this quadrant inside here is what we call the care desert. That care desert is known as non-emergent care. The reason why health insurance costs are going up is because of the amount of claims that are being presented. Those claims are directly tied to hospitalization or emergency rooms. In order to reduce health insurance costs, you have to reduce claims. In order to reduce those claims, you have to have a bridge over that care desert, which is what EasyCare2go does. EasyCare2go uses technology to allow you to be able to access healthcare and be that bridge for non-emergent care. How do we do that? Here's what happens in insurance that most people don't think about. You pay your monthly premium faithfully, and you should. You have a contract, and you should. You pay your copay. You pay your deductible, and you pay a maximum out-of-pocket expense. That's 4 times you've made a payment in cash before the health insurance kicks in. What EasyCare2go strives to do is to be able to give you, as a member, an alternative where you are now able to pay cash at pre-negotiated rates for your non-emergency healthcare programs. Any of those needs can be handled virtually. 80% of emergency room visits have been statistically proven that they are unnecessary and could have either been handled virtually through technology via telemedicine or could have been handled through a urgent care clinic or a minute clinic, such as CVS minute clinics. It has also been a proven fact that most people, up to 70% or better, goes to hospitals because of injury, not because of sickness. So because of this, that care desert that I'm telling you about, non-emergent care, sits right there, and many people fall into it, end up getting exorbitant emergency room visit fees or getting exorbitant hospitalization fees when it could have been avoided or could have been alleviated if they were able to use a non-emergent care program. What EasyCare2go allows you to do is to be able to take all of those cares and to put them through accessibility to doctors 24/7 without any consultation fees. You get access to over 195 prescriptions at zero cost because you remember if it's prescribed by one of our doctors. You get the option to shop and compare both nationally and internationally for medications for those high tier 3 and tier 4 medications. You also get the opportunity to apply for prescriptions assistance when necessary if you need it. The other beautiful thing that EasyCare2go does to help to relieve some of the stress on the healthcare system is that we understand that our members also have issues dealing with mental and behavioral health. This is a big issue nowadays. The country is stressed, the world is stressed, and people need somewhere to go. Every one of our members get access to 12 50-minute sessions to use any way they like per year. They can use them all at one time, or they can use them spaced out. And that's for every immediate member of the household get access to those 12 sessions. So if there are 5 people in your home, that's 60 sessions in your house that you are able to use. And the beautiful thing is, as a member, you have the lowest session fee rate in the country. Our members pay $25 to $50 maximum for a 50-minute session, being able to talk to a fully certified counselor when you need it. The other beautiful thing that we do at EasyCare2go is that EasyCare2go has access to over 5,000 labs nationwide. All of LabCorp and all of Quest Diagnostics are part of our platform network. So you have an opportunity to get access to labs at pre-negotiated rates. The challenge with laboratory services is this. You go and you get your labs, you get the result, And now it's in legalese. You can't read it. Now you have to find a doctor to go ahead and interpret that lab for you, and then you have to pay for your medications. At EasyCare2go, we've made it easy. What we do here is that all of our members, once they've accessed the lab through our convenient phone app, they're able to prepay for that lab at negotiated rates. Then, for a flat $25 fee as a member, you get access to our doctors. Once you've received the lab result, they will come in, interpret your labs for you. They will prescribe a necessary treatment plan if it's required, and they will call in your prescriptions for you. That's one of the beautiful things about EasyCare2go. Who are the people that get helped with EasyCare2go? All of those 1099 employees. Imagine if you're a trucker and you're driving over the road and you're out of your medication. What do? How convenient is it to have someone riding shotgun, which is EasyCare2go, sitting beside you? You can pick up your phone, get on the app, select your medication, order it in the next town, and stop there, get your medication, and don't have to break a stride in making your delivery. If you're a barber shop, a salon, a nail technician, you know how important it is to be there for your clients. EasyCare2go wants to be there for you. How do we help you? Let's say you have a client that came in and they're really stressful day to day, and you have to do everything you can just to hold it together because the customer is always right. How cool is it to be able to schedule a mental health visit, to be able to talk to a counselor on your lunch break, to help you hold it together during that difficult time? And if you should need medications, you can simply order it and pick it up at any one of the 66,000 pharmacies nationwide. EasyCare2go is designed to make healthcare easy. If you're a part-time employee and you don't have more than 30 hours of work time per week, you have access to no benefits. An employer can now offer these benefits to their employees and allow them to be able to get access to health care, not just for themselves, but for their family. Wellness is also a major issue in EasyCare2go. We provide for people who have problems with smoking cessation, problems with diet, weight loss, weight gain, just emotional issues, lifestyle changes. You get a true wellness coach that will work with you, and all of our services are integrated. So if you happen to have diabetes, for example, your wellness coach knows to create a program that does not affect your medication. At EasyCare2go, we've tried to think of everything that we would need as a member. And while we're at it, I'll give you a personal example of what happened to me. I'm not just the CEO. I'm not just the managing partner. I'm also a member. One day I was traveling and I got sick at a convention. When I came back to my hotel, I could hardly breathe. This was during the time of the health scare. I didn't know what I had. I called our service. I spoke to a doctor. The doctor told me go to the emergency room. I opted to go to one of our urgent care clinics because it was during the day and one of them were open. When I went there, I had a COVID test done. They found no COVID. I had an x-ray done. They found pneumonia in my lower left lobe. So I had an x-ray, I had a visit fee, and I had a specialist that came in and to help me with the problem. They gave me an antibiotic cocktail shot at that time. My total maximum out-of-pocket expense with no insurance involved was $362. Now, if I had gone to the emergency room, my visit fee would have been 2 to 3 times the amount with no services rendered. EasyCare2go is the future of healthcare because we have learned how to use technology to help assist members and care facilities to be able to provide more efficient, price-transparent services for all members, for everyone, regardless of gender, regardless of persuasion, regardless of any condition. EasyCare2go, make it easy.
EasyCare2go.com. Vital for you, vital for your loved ones.